Hi, my name is Carly. I've been working with Genetic Protocol for about 9 months. I came to Dr. Hunt after having a very rare illness called Guillain Barré Syndrome. It's an autoimmune disorder that afflicts approximately 1 in 100,000 people. And I came to see Dr. Hunt about a year post-diagnosis. My other doctors I had been seeing had told me that they had pretty much reached the end of what they could do for me. And a friend of mine referred me to Dr. Hunt. And one of the first things I noticed about her was the time that she spent with me as a patient, wanting to get to know my history and to learn all about me as an individual. She started me on her protocol, and what really made a difference for me was my level of fatigue decreased. I had much more endurance, and when I had my Guillain Barré syndrome, I was paralyzed and unable to walk, and by the time I was coming to see her, I was able to walk again, but my endurance and my strength were very decreased still. So working with Dr. Hunt, she spent all the time with me to really learn about what was happening with me, and she recommended supplements and diet change, as well as sunlight and watching the sunrise. And all of these things have contributed positively to my overall recovery. I'm much happier than I had been, where I felt like I had no hope from what the other doctors told me. So Dr. Hunt gave me that hope back, and I see her on a regular basis, and I still continue to see improvements based on the recommendations that she has for me. When I was first diagnosed, I was in a hospital setting, and they had told me that the Guillain-Barré typically peaks at about 2 weeks post-diagnosis, and I ended up being in the hospital for that first acute care hospital for 59 days, where they told me that I would probably spend the rest of my life in a long-term care facility and that I would never walk again. After that, I did learn how to walk again and was back at home living independently, but my independence was a little bit different than it was before I became sick. I still felt like there was a difference, and I felt like I was not the same person I was prior to becoming sick. Every doctor that I worked with post-diagnosis told me that I was just lucky to be able to walk again, lucky to be alive, and I really had no hope until I came to see Dr. Hunt. She spent about an hour with me at that first consultation and went over all of my symptoms that I was still experiencing, and she told me that she wanted to be really aggressive in reevaluating me and treating me. I participated in all of her protocols, including the genetic protocols, and Dr. Hunt was able to diagnose me with another autoimmune disorder that was missed by my previous physicians. I was diagnosed with Hashimoto's, which is another autoimmune disorder. And I had been seen by about 9 different doctors while I was in that first hospital, and nobody had diagnosed that particular illness. So I really felt like Dr. Hunt spent a lot of time listening to me. And one of the things that I've noticed in my recovery is that the doctors and therapists that contributed most positively to my recovery were those who did listen and treated me as a person. And that's what Dr. Hunt does. She treats you like a member of her own family, where you're not just a number. And that has made a difference in my recovery to the point where I'm back to living a normal life. And I'm able to be a single mom taking care of my 2 children. And I'm active again. I have an active social life. I'm active physically. I'm able to run and walk and participate in all sorts of physical activities that I could not do prior to coming to see Dr. Hunt.